Hi, my name is Clarissa Giebel, and I'm a Senior Research Fellow in the HCAL team. Today, I'm going to give you a bit of an overview of the progress and achievements of the Liverpool Dementia and Aging Research Forum. So the forum originated in September 2019 after a lot of thinking because there didn't seem to be a coherent mass yet and existing network for all the dementia researchers and health and social care professionals, charities, and people affected by dementia, people caring for a loved one with dementia. So I thought, let's try and set up this forum, set up this network so that people can engage people that are working in the field, that have lived experiences in the field, and come together to network and create joint research to really make it valuable and reflective of the needs of people affected by the condition, but also that we just have a general collaboration and raise awareness amongst one another and with the general public about dementia. What's going on? What's the latest research? What's the latest services available, etc. So humble beginnings. In September 2019, we had our first face-to-face conference back in the non-COVID days. And as you can see on the first picture there, it's Dr. Warren Donnellan. He's giving the first forum seminar in November 2019. As I said, humble beginnings, but we've started to grow really quickly, which is lovely to see. So at the bottom, you see Dr. Rhys Davies from the Walton Centre giving his talk on rare dementias. A few weeks before national lockdown, in fact. And we also see at the top corner a picture of our then PPI group led by Dr. Sarah Butcher from Mercy Care. So a number of carers and people living with dementia there to just discuss what's affecting you, what do you want to see in terms of research, where should we go as a joint effort. So what does the forum offer? As I mentioned, we offer networking opportunities and really to raise awareness. What is dementia? What's the latest research? What can we do together? So there are a number of opportunities. We've got bi-monthly public webinars. We've got monthly journal clubs where we discuss the latest research, also with the Alzheimer's Society in attendance every month. We have regional networking meetings where we specifically focus on matters arising in the Liverpool region and beyond. Just to highlight here, the forum is national and international. It's called the Liverpool Dementia and Aging Research Forum just because we're based here and it originated here, but we've got many national and international attendees at our webinars and also at our annual conferences. And I'll share with you the details of this year's annual conference as well in a bit. As I mentioned, it's not just about researchers. If we just live in our ivory tower, we won't address the needs and wishes of people living with the conditions or caring for a loved one with a condition. So we are really working very closely with charity providers, with health and social care professionals, and this is just a snapshot of the organizations that we're working with. And when I mean working with, it means they're active team members. They are written in as co-applicants on research grants. They are helping with the dissemination of our research and our co-authors, etc., and really help to bring out what's important, what should we do, and help us to reflect on the findings as well. And obviously we don't just have organizations involved, we also have people living with dementia and unpaid carers as part of every single research project that we do. So as I mentioned, the bi-monthly webinars, the next one is taking place at the end of this month on the 30th. And this time we are having Janet Hock, who is lead admiral nurse on the Isle of Man. And we have Emma Stafford, who is a dementia care navigator for Liverpool. And we'll be specifically hearing about dementia care after a diagnosis. How can admiral nurses and dementia care navigators help? So dementia care navigators are quite patchy, as our research has highlighted. So we wanted to understand and really share with the general public, how do these types of roles complement one another? What do admiral nurses do? What do care navigators do? And also, if you need help, if you need support, how can you get in touch? How can you access that support? So the link is there, but I'll share it in the chat box as well if you want to join. The other angle of the forum is also the research and the collaborations. This is a list here of some of the research that has been funded. Some of it has been completed, some of it is still ongoing. And as you may be aware, I've spoken about this before, the key study really, I suppose, is the COVID-19 social care study that we've published on a lot. And we've had more charity and health and social care professionals and carers involved than academics as team members on this project. So it was about 20 members, which was fantastic to work with. And we're also looking at international projects on the mental health needs of older adults. And we have just started a couple of new projects as well, which I'll go into more detail in a few minutes, focusing on finance management and unmet mental health needs. And again, just to kind of highlight here as well, these ideas for the studies, especially the unmet mental health needs, they are building on the research that we've done in the early stages of the pandemic. They have originated out of the findings, but also out of discussions with carers, paid carers and unpaid carers. So really showing that integration of everyone as part of the forum. In terms of research as well, obviously, yes, we have to publish in academic journals, but what we also really want to do, and this is particularly done by working with the Alzheimer's Society, for example, or the Liverpool Dementia Action Alliance and other charities that are working on the ground, is we are trying to put these findings into practice where we can, or at least take that next step. So we've written 2 policy briefings on our COVID-19 research, on our community research and care home research, and we're working with the Liverpool Heseltine Institute on this. And there'll be some more policy briefings to come as well. So just to highlight, we really want to make that step out of the research bubble and really try and improve the care for those affected by dementia. And just to highlight, as I mentioned, that we are also doing international work. So it's not just in the UK, we're doing a lot of collaborations with the Netherlands in particular. They seem to really do care quite well. So we can learn a lot from them, and we are doing also international work with low and middle income countries. So where dementia care is often not as advanced, and also dementia in general is not as acknowledged and quite stigmatized. So again, it's about that knowledge transfer. What do we maybe know from the UK or the Netherlands, and how can we maybe implement that in other countries to try again and improve dementia care? Some numbers. So as a researcher, I obviously have to share some numbers with you here. So looking at the average numbers of registrations for the forum seminars and our webinars, it's around 191. The peak registration was noticed in January last year when Professor Siobhan Riley and Dr. Andrew Harding presented, and we had over 550 registrations peak. We've had 10 funded research projects, smaller and larger ones. So far, we've had 21 publications emerging from research from the forum. We've got 2 submitted applications, 3 in preparation, and we are working currently, hopefully soon more, with 7 different countries on different research projects and generally looking at how we can improve dementia care. Some new projects. So we are involved with 3 national implementation projects as part of our ARC. So the first one, the Wells into Practice, is led by ARC Wessex. And then we've got 2 national implementation projects that are led by ARC Kent, Surrey and Sussex. So it's great to have that national engagement and for the Northwest Coast to be represented as well. So one is looking at wellbeing in care homes and the other is looking at digital technology and aging. So there'll be more information about that in the next few months. They've just started. In terms of projects emerging from us, led by us at the University of Liverpool, we are currently open for recruitment for our finance management and spending habits and dementia study. We've interviewed around 13 participants, I believe, to date. So unpaid carers and people living with dementia, but we really want to speak to more. We really want to understand how the pandemic also has affected spending habits and finance management in dementia. So one-off interview remotely. So if you are interested or know someone that's interested, please get in touch. We are also about to start, well, we have started, we're just waiting for ethics. We've been funded by the NIHR and the Policy Support Fund to look at unmet mental health needs of paid and unpaid carers for older adults with and without dementia. And as I referred to before, this particular study has really strongly originated from the COVID research that we've done with charities, care providers, etc., because we really found that there doesn't seem to be much of a focus on mental health of carers, but now we need to understand better how it varies across different types of carers, so care home staff, home care staff, and what these groups of people would like to do to improve their mental health. So again, we'll be looking to interview participants remotely. And just to highlight, towards the end of this, our 4th annual conference on the 12th of October will take place face-to-face again. This year, it'll take place at the Flory. We've got a keynote speaker who is Siobhan Riley, because she certainly busted the numbers when we had the January webinar last year. So we thought, let's invite her as a keynote speaker. She's from the University of Bradford, and she'll be sharing her research into dementia care. We will also have a policy debate with the Alzheimer's Society, the Liverpool Heseltine Institute, and the Liverpool City Council, and potentially one other panelist. As I said, we are called the Liverpool Dementia and Aging Research Forum, but we are national and international, okay? There are opportunities to submit abstracts, and you can register if you are working in the field or if you are a carer or a person living with dementia. And that's it from me today. So there's much more to come in this space. Watch this space, and if you want to get in touch with me to join the forum events or take part in research or just have a chat what we're doing, please drop me an email or follow me on social media. Thank you very much.